In this video, we're going to show you how to clean your face after CO2 laser resurfacing. This patient's only had the eyes and cheeks done, but the principles remain the same. She was laser resurfaced about 2 to 3 hours ago. You can see there's already some buildup of a small amount of little bleeding spots. That's totally normal. So we're going to go ahead and clean those. So we're going to start, look at some of these supplies you want to have gathered. That water bottle has the vinegar and water solution in it. We have a fresh tub of Vaseline, a spoon that's been wiped down with rubbing alcohol, and a nice set of standard sort of makeup removing pads. So we're going to saturate the makeup pad with the vinegar and water solution. Remember, the key to this is frequency and thoroughness, not intensity or being too vigorous. We're just going to gently wipe off the little goopy stuff that's starting to form on the skin surface. Remember that the vinegar has an antibacterial property to it, which is very helpful to the healing laser skin. Everything is about cleanliness and not reusing things. They're used one time in a clean fashion and then discarded. So we simply wipe off the goopiness, for lack of a more medical term. That's not medical, but everybody understands what that means. The hands were of course washed before doing this. Keep the vinegar and water solution in your refrigerator. It'll be more cool and provide more soothing. And again, we're being thorough. We're going to do this frequently, but it's not about intensity. You're not there to like rip the skin off. You're just there to get the little goopy stuff off. There you go. Take a little dry one and just kind of pat, don't rub, pat it dry. Excellent. Let's go to the Vaseline step. Now the spoon that you see here has been wiped down with standard rubbing alcohol you get at the drugstore. So the spoon is pretty clean. We're going to take one scoop out of the Vaseline, and you never go back to the Vaseline with a dirty spoon. Once you've scooped it, that spoon is considered used, and we're not going to go back. So now, with clean hands, we're going to apply a nice smear. Some people say it's like putting icing on a cupcake. Nice, completely occlusive smear. Go. Now again, you can imagine if you had the full face laser, this process will be even more time consuming. The principles all remain the same. Again, it's not about roughing up the skin, it's about being gentle and thorough. So cleaning the skin could be every 2 to 3 hours for the first couple of days, and you just have to kind of watch the skin. There's a little bit of a judgment and art to this, but obviously as your skin becomes less weepy, you don't have to clean it as much. You don't want that goopy stuff to build up on your skin, because that's a wonderful little environment for bacteria where they could cause a skin infection. And so keeping things clean with thorough, gentle cleaning, frequent cleaning, but not aggressive cleaning. And again, if you did the whole face, it'd be even more time consuming, but that is for sure part of laser resurfacing. Is for the first several days, you're gonna be spending a lot of time in the bathroom in front of a mirror, but that's going to give you the best result and avoid complications such as infection and other problems. We are about 5 hours since the laser resurfacing, and it's only been 2 hours since our last cleaning. Some of those purple lines are the surgical marks. Don't worry about those, they come off. But you can see little pinpoints of blood. And again, if you think like a surgeon, bacteria would just love that blood. Perfect way to set up an infection. So we're going to get it cleaned off. We've got our pad soaked in our vinegar water solution. And again, it's about frequency of cleaning, thoroughness of cleaning, but not intensity. Better to just be gentle and thorough, and you want to keep that little weepy, bloody stuff off your skin, because that's obviously a great way to set up for a skin infection. I don't want to scare you with the skin infection talk on this laser video, but sometimes, as we say as a doctor, knowledge is power. So if you kind of know what to avoid, you'll stay out of trouble. So let's get that other side clean. Same thing. makeup removal pad and just get that weepy stuff off of there. Again, you're not trying to disrupt the skin, you're not trying to like take the surface off of the skin. You're just trying to get that weepy stuff cleaned. iPad just to dry it. So for those of you who had full face laser, which is pretty common, you can picture that you're going to be spending a lot of time in front of your bathroom mirror for those first several days, but these details is what helps to give us that beautiful, safe, and final result. So once again, that spoon has been washed down with standard rubbing alcohol. We're going to take only one scoop out, and we're not ever going back to the jar unless we have a clean spoon, so you never contaminate your Vaseline. And the hands are always washed right before you start this process. And of course, just for good hygiene, wash them when you're done. But again, you'd never, for example, you'd never stick your finger back in the Vaseline now, because then you could move some bacteria going into the Vaseline. So do that, and that's how you keep your face clean. We'll do the other eye and then be done. Let's get a close-up before we do the other eye. Just so you can see, again, about 5 hours post laser resurfacing, 2 hours since the last cleaning. So this is the second day after the procedure. If we want to be really accurate, we're about 30 hours since the procedure. Our model here has undergone, this will be cleaning number 6. Now keep in mind, when she woke up this morning, it was fairly little pinpoint bloody around each eye, and so we used a gentle cleanser. Now this video is being filmed in 2021, and our recommendations may change as different products come out. But currently, at this time, the Ulta MD Gentle Foaming Facial Cleanser is a really great cleanser. And what our subject did here was kind of wetted her face gently, used a little bit of soapy, and it makes a really nice gentle foam, got some of that yucky kind of dried bloody stuff off of there, and then began just reapplying the Vaseline. So again, here we are now, 30 hours post-procedure. There's been one morning cleaning, and we're using all the same products. We've got our vinegar and water solution in a little shaker bottle. We've got our Vaseline. We've sterilized our spoon with some of the rubbing alcohol. So we're sticking with all the basic principles we've talked about so far in this video. Now we just have to reapply some Vaseline. Again, the key here is frequency, maybe completeness, but not aggressive. The big mistake you can get into, 2 big mistakes you can get into: don't be thorough, and then you have all that weepy stuff, which is a great little setup for a problem. And then the other problem you get into is being too aggressive. This is resurfaced laser skin, and so you want to be gentle with it, and that skin looks perfect. You can tell the eyes are pretty puffy. That's not too bad, it's just kind of in the range. Yours may be less puffy, more puffy, but that's still well within the normal range. And just keep those products on there. And this is a great example of 30 hours post-procedure, cleaning number 6.